Yeah, so it's very common in football, obviously. And what happens is usually the knee twists abnormally. And it's normally quite a complex movement starting at the hip and then going down to the knee. And as the knee pivots and twists, and what we call as usually a valgus movement. So if you imagine knock-legged position and the knee twists, as it twists, the central pivot point, the knee can tear the ACL and the knee can literally pop out of joint, pop back in again, and then there's no ACL. So normally it's a non-contact injury. It's normally changing direction. And as you change direction, you twist or you land and pivot on the leg. You feel something pop inside the knee. Often there's actually an audible pop. Uh, Usually people fall to the ground because they can't continue to stand. The knee suddenly swells up. They're in a lot of pain. It's usually bad enough to take people to hospital. And when you hear that history, 100% of the time, pretty much, they've torn their ACL. And we see it most commonly in soccer, football in this country. And it's in women, it's actually more common in netball. And it's more common in women, which is what we're going to focus on for the interview. You're from Norway. Actually, an observation was made by a famous Norwegian orthopedic surgeon called Lars Engebretsen, and the country as a whole. Your handball team, the female handball team, about 15 years ago, all these young ladies ranging from ages 17 to 25, whatever it was, had a minimum of one, and some had 4 ACL ruptures. And at that time, actually, as a nation and as an organization, the authorities, the medical authorities there began a really fantastic initiative to stop ACLs from tearing. We can talk about that later, maybe, by warming up appropriately and doing an injury prevention program. And that's now, you're leading the way in Scandinavia with that. Well, in terms of how common is the injury, it's become a lot more common in children as well as adults because everyone's playing more sport. The pitches have changed, these 5G pitches, the shoe wear's changed. People are pushing themselves harder and harder. Elite athletes are pushing themselves harder and harder. The football players are playing constantly, they're training constantly. So it's the instance of ACL, it's good for ACL surgeons, is it's sort of done this. The techniques have transformed enormously over the last 15 years to make it less invasive and to make the surgery easier to recover from. The one thing we can't really speed up is the time it takes for the new ligament to incorporate. So sadly, when someone tears their ACL, usually they're out for 9 to 12 months as a minimum. So that's been looked at in great detail because obviously, we've noticed it for many years that the incidence in women is higher. And it's due to being more flexible, anatomy of the pelvis, anatomy of the knee. The notch in the middle of the knee is broader in men, it's tighter in women, so it amputates it more easily when you have these pivoting injuries. Limb alignment is different in women compared to men, so it makes them more predisposed to this injury. It's therefore, there's also a hormonal influence. So the estrogens and so on that are higher in women than men also drive this particular injury. So it's a combination of anatomy, physiology, hormonal influences, and just being more bendy. What would she be doing now in terms of her rehabilitation and the recovery process? If you can get straight in, and there's no real place for conservative management, the chance of her being able to play football and pivot without an ACL at that level are extremely low. So surgery is the way forward. If you can get in quickly, immediately, you can do the surgery within the first day or two, or even week or two. If you leave things, and obviously they won't in this case, then you have to wait until the swelling goes down and you regain a good range of motion before you can proceed with the ligament reconstruction. So she'll be icing her knee. There's some really fancy cryotherapy devices now, ice and pressure, that make a massive difference. She'll be resting it, icing it. She won't be doing very much. And then she'll be gearing up for surgery. And the surgery should be done expediently for her. And then once the surgery's been done, the procedure takes between an hour and 2 hours to perform the surgery, depending on what else has been damaged inside the knee. It's a day case. She goes home the same day. And then rests her leg with it elevated, the ice machine, gently gets the knee moving, gently fires up the muscles at the front and the back of the knee to get moving again. And you should be off her crutches within a couple of weeks, down to maybe one crutch, no crutches at 2 to 3 weeks, gently getting the knee moving on a static exercise bike at 4 weeks, onto a treadmill at 6 weeks. She'll start to feel quite comfortable around about 6 weeks. She'll want to start to, she'll be doing all her upper body stuff. In terms of her knee, she won't be doing anything too vigorous until about 3 to 4 months, and then she'll start to really ramp it up. Absolutely. She's got a really good chance of making it all the way back to the same level. And the great thing about treating an elite athlete is they're so determined, that they just do so well. So the best people to treat, because they've got great opportunities in terms of rehabilitation with physiotherapists, etc. And the determination is there. So they tend to do brilliantly. So she'll be back playing better than in fact, she could strengthen her knee to the point where she likes that one more than the normal one. Yeah, not really. I mean, she may not have done a really focused injury prevention program prior to this. It is coming into elite sport and into schools. So there's a great initiative for the Australian Female Netball Association, and these are popping up. FIFA has one for children. And so her physios will be focusing a lot on teaching her how to land with her hips so that she doesn't turn her knees in. She actually lands with her knees slight in this position rather than going out and twisting to minimize her risk of a further injury. So there'll be lots of work on strength, lots of work on balance, and there'll be lots of work on teaching her how to not do it again. You need focus for these things. So, elite athletes are extremely focused individuals. And she'll be made aware of the fact that she shouldn't overdo it. So she'll be pushing herself to the right limit every day. And the nice thing about recovering from an ACL is you see very rapid improvements, particularly in the early phase. And there are, set phases of rehabilitation that she will go through. And at the end, she'll have a return to play assessment performed on a regular basis to assess, how well she's bending it, how strong, how good her balance is. And how prepared she is bouncing around. There's lots of different tests we can do. And if she ticks all the boxes, she may even get back at 6 months if she's already at that point. But for somebody of her age, it's normally 9 to 12 months before we're happy for them to return. But yeah, I mean, in answer to your question, having a good mental attitude to the process is really important. I mean, this won't apply to her, but smokers don't do quite so well. So not smoking and eating well, being sensible about actually exercising and getting in the gym, doing not just sessions with a physiotherapist once a week for the sort of lesser mortals,